In the epicentre of the Mpox outbreak, the telltale symptoms of painful blisters are plain to see. Here in the Democratic Republic of Congo, there have been more than 25,000 cases and more than 800 deaths, most of them children.
It is really hard to see an infant with this disease, with the blisters, with the fever, with with all of those challenges. And it's a serious disease, and it's spreading, and not enough is being done.
The first human case of Mpox was in Congo in 1970. In 2022, the virus attracted worldwide attention during a global outbreak that affected 115 countries, including the United States and Australia.
Symptoms of Mpox are quite severe: fever, headaches, sometimes difficulty breathing, but the thing that's most visible, the things that most people recognize, are the skin lesions, the pus bubbles that appear on all parts of the skin. When the first part of the disease, they look like blisters. Later, they can blacken and can cover all parts of the body.
Mpox can spread from person to person through close contact, including skin to skin and kissing, or via contaminated objects such as bedding. It can also spread from infected animals. Most people will recover, but in some cases, it can kill.
80% of the deaths and 70% of the cases are in children. And the case fatality rate overall in DRC has been 4.6%, so quite high.
An upsurge in cases in Congo and other African nations this year led the World Health Organization to declare a public health emergency.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law.
Since 2022, there have been more than 100,000 cases globally. In Congo this year, more than 25,000.
Things have just got steadily worse in DRC. They haven't got better at any point. They've just got worse and worse, to the point where this year we've seen spread to other African countries, and that's new. Countries that are non-endemic for Mpox, that have never seen Mpox before, like Kenya, Uganda, and a case in Sweden and also in Thailand.
This time round, a different strain of Mpox has experts worried. Known as Clade 1, it's historically had a higher death rate.
Up to 10%, which is really pretty serious. So the original SARS virus in 2003, that was about 12%, to put that in context.
Clade 1 has yet to reach Australia. In Western countries, most Mpox cases have been among men who have sex with men.
The pattern was much more clearly sexual transmission.
In 2022, a mass vaccination campaign for at-risk groups in the US and Australia brought cases down. But in Australia, Mpox has bounced back. Here's the number of cases in 2022, 2023 and now 2024. So far, there have been no deaths in Australia. While Western countries have been quick to procure the vaccine, Congo has had none until this month.
The vaccines are quite expensive. The vaccines that are used against Mpox are third-generation vaccines, and we're talking about maybe approximately around $100 a dose, and the one that was used in Australia, for example, you need 2 doses. So that's a big ask for a low-income country, and I think it's as simple as that. In 2022, countries that could afford it lined up and procured the vaccine, but also there's very limited amounts of this third-generation vaccine in the world.
The cost, combined with a slow and complex approval system, has led to vaccine inequity, according to Jane Holton, a former Federal Health Department Secretary, now the chair of the Coalition for Epidemic Preparedness Innovations, which advocates for vaccine development.
I don't think you can blame any one agency for what has happened here. What you can say is that the system doesn't work quickly and together to address what is self-evidently a crisis.
Vaccines have begun arriving in Congo, with European nations and the US committing donations, while Japan alone has pledged 3 million doses. But the Africa Centres for Disease Control estimates that 10 million doses are needed.
I think probably not enough attention has been paid to what's going on inside the African continent, particularly DRC, but other countries. And fortunately, that has now changed, but it means we're starting off a really low base when it comes to getting vaccine, getting it deployed, and actually protecting particularly those children. It's also important that countries in Africa not have to rely on charity and donations from wealthy countries. And we know what happened in COVID. Wealthy countries looked after themselves first. So we need a much more equitable approach to distributing vaccines and making sure they're available when they're needed, where they're needed.
While the WHO has said it does not believe Mpox is the next COVID-19, some experts are worried about its potential.
The epidemic in DRC is looking like it's spreading quite easily and quite fast, and it's a warning. It's a warning that this could be a virus with pandemic potential.
For now, aid groups want the vaccine to reach those who are suffering the most quickly.
The world seems to only pay attention to the healthcare needs of children when there's fear that the disease will spread beyond the borders. What's needed is continued investment in healthcare systems and in all that's needed to keep children safe and healthy so they can grow up and have the childhood that they so deserve.